Okay, ARDS-NET protocol. So the ARDS-NET protocol, that one. So here it shows the inclusion criteria. So for our acute onset, like our PaO2 and our FiO2 has to stay under 300 corrected for altitude, bilateral patchy, uh, diffuse or homogeneous infiltrates consistent with pulmonary edema. So like these are requirements that would categorize you as an ARDS patient that this protocol would help. And then no clinical evidence of left atrial hypertension. So on part one right here, all this kind of pretty much explains how you calculate and do your ventilator setups and adjustments, so that you are able to, have those low tidal volumes and be able to have them oxygenate properly without causing further damage. So initial ventilator setups and adjustments are a little different for females and males. So for females, we calculated 45 plus 2.3 times the inches over 5 feet. So we will calculate that. And then once you get that body weight, predicted body weight, you will do it 4 to 6. So your low range would be, you will multiply that body weight by 4, and that'll be your low weight tidal volume for your patient, and you multiply it by 6 for your height tidal volume. So you'll try to pick somewhere in between, and that way you're not too low or not too high. So you can kind of have some wiggle room and adjust it. You can go from 8 to 6 in a normal person without ARDS. The ventilator settings are 6 to 8 milliliters per kilograms. Some ventilator settings will like you to start at 8, so they'll try to have you start their ventilator parameters at the high rate and then start reducing their tidal volume by 1 milligram per kilogram at intervals of every 2 hours, until you reach that 6, which is like their safe zone to not overextend their lungs and cause any more damage. And then you set their initial rate at a baseline for their minute ventilation, and then adjust tidal volume and respiratory rate to achieve an adequate pH and plateau pressure goals. For men, it's the same thing, except for the calculation. Instead of adding 45, it'll be 50 plus 2.3 inches times, or 2.3 times your inches over 5 feet. Same thing, you will calculate your high tidal volume and your low tidal volume, set up your parameter to achieve your 8 milligrams per kilograms on your predicted body weight, and then slowly reduce down your tidal volume 1 milliliter per kilogram at the intervals of 2 hours until you reach your 6. Set initial rate to baseline minute ventilation, and then adjust your tidal volume and respiratory rate to achieve your pH and plateau pressure goals. It's just lower tidal volumes for ARDS patients would help them oxygenate better and prevent any more damage to their lungs.